Well, good morning, everybody, both here in Syracuse and out there in Zoom land. My name is Dan Cummings. Before I officially introduce you to our summit, there's a busy man who would like to welcome you to Syracuse and Onondaga County, and then he'll be able to take his leave from us, but not before he issues a few welcoming remarks. The Onondaga County Executive, Ryan McMahon, is with us. And he not only is the executive of Onondaga County and has been for the last 5 years, but he got started in public service at the ripe young age of 25 when he was first elected to the Syracuse Common Council. He's focused a lot on economic development, infrastructure, and the like, trying to eradicate poverty from this community, but he knows a thing or two about Lyme and tick-borne diseases as well. So to welcome us to our Lyme and Tick-Borne Disease Summit, please welcome Onondaga County Executive Ryan McMahon.
Well, good morning, everybody. And I know I just had the opportunity to meet many of you, and I want to thank you. Thank you for the work you do day to day. It's important work, and I'll share with you a couple of experiences I've had personally. But also thank you for coming to our community and being here. And hopefully while you're here, for those of you who don't live here, you'll get an opportunity to explore a little bit. We're very, very proud of the renaissance we've had with our downtown. We're very proud of the renaissance we've had with Onondaga Lake, which at one point was the most polluted lake in the country. And as that lake has been cleaned up, our community has seen a comeback. And we've been able to take advantage of what a body of water that borders your city should. And most recently, we're very proud of the fact that we participated and landed the largest economic development investment in the history of the United States, a $100 billion project with Micron Technology. And I can assure you that one of the reasons in the site selection process that we landed this investment was because of our strong medical infrastructure. And eds and meds for a long time have kept this community going when we lost other sectors. And so that infrastructure is going to be critical moving forward as we're a growing community. And we learned a lot during the pandemic about partnerships. And I think we're going to need to take those same lessons when related to the topic of today. I'll share with you, I'm a dad. I have 3 children, and my first, I was a county legislator, and the issue of Lyme disease and ticks and management plans really started to gain traction in our community, as the data showed, and with professionals like Brian from ESF, was working on this, that this was becoming a real issue, and that we were seeing a spread from really the Long Island area up throughout the rest of the state and the Northeast. And then as that's going on, and I'm learning about more of it from a legislative perspective, I had a scare with my daughter, who came in one day, and sure enough, right on her shoulder, there's a tick that's digging in through her skin. And I had to use the same tools that you're giving out today to get that out. So I got more engaged in the issue. As a parent, as a legislator, funding different plans in the county. And then, one morning, I was in the shower, and I kind of felt the back of my thigh, and I thought I had a skin tag. It's the back of my thigh. I can't see it. So I just, didn't really think anything of it. And then, certainly the next morning there, and I'm picking at it, and, couldn't get it, and so 2 days later, I finally picked my skin tag, and it wasn't a skin tag, it was a tick. And I, knowing what that could mean for me in my own health, I was mortified. At the time, I was county executive now. So the nice thing when you're county executive, you have a doctor, a health commissioner, Dr. Gupta at the time. And so I called Dr. Gupta up thinking she was my primary care doctor, and she wasn't. And I demanded to get nuked with the medicine. I said, give me the biggest dose you can give me. And she said, you need to go to your primary care doctor. But I was, I think 37, 38 years old. I hadn't seen my primary care doctor in like 15 years. And so I went to look, and my primary care doctor retired. But Dr. Gupta got Dr. Kwan to come up and get me that prescription. And that they gave me a big dose, and they monitored it and tested for it. And we tested the tick at the lab, and certainly it did carry the bacteria, but I was okay. And then I got into COVID, right? So in county governments, we have public health departments. So we run the public health response in New York State to the pandemic. And certainly during that consumed everything we had. And I had another health this time, a very serious health scare. And I didn't realize the grasp of what the challenge we face related to Lyme disease is until that moment. I woke up, and actually it was a Friday evening, and our team was working 20 hours a day. And I remember that one of the local businesses bought dinner for my team that really basically we quarantined together. Essentially, we had our pod and we worked every day, and I wasn't feeling well, a little dizzy. And I went, into the conference room where they were serving dinner, and everybody was there and having a glass of wine. And I started having a couple of glasses of sips of wine, and all of a sudden I was, really dizzy, and my vision was very blurred. And I was like, "There's no way I'm drunk after having 2 or 3 sips of wine." So a little concerning, but I didn't think anything of it. Got dropped off at my house. The next morning I woke up, and I couldn't see a thing. I literally could not put together anything. And so, sure enough, we get back to one of you'll all laugh. I had, after the Lyme disease episode, my deputy county executive, Ann Rooney, gave me her doctor as my primary care doctor, but I had yet to see him. And so, I couldn't even see my phone. So I used the technology, and it voice dialed in. And I said, I got to talk to Dr. I believe it was Pashoric. So I did. And I'm talking to him. I'm explaining my symptoms. And he said, "You need to get to the emergency room immediately." And so I couldn't see. I was very anxious. I got dropped off at the emergency room. It's COVID. So I got to feel firsthand what it was like to be in a hospital then and not be with anyone that you love by you. And one of the things during COVID, which is remarkable, that I'll share with you, the very invasive COVID tests to this point, I was able to avoid those. I always had either a rapid test or a saliva test at Upstate, but I couldn't avoid it then. I couldn't see. They got right on me and drilled me. But they went on, and they had to rule out a couple things. Is they what I was experiencing most of the times, you have either having a stroke, a brain bleed, or a brain tumor. And then that wasn't the case, thank God, through MRIs and CAT scans later on. And then they gave me a spinal tap to check me, I believe, for MS. And then the other thing that they were trying to confirm was, did I have Lyme disease? And so for me, that was something that I never would have put that together with this thing. The reality was I didn't. I basically, because of stress and a thyroid that stopped working, I was a ticking time bomb, and I basically had a vascular event in my eye. And then eventually my vision has come back probably about 90% since then. But it showed me how complex this is, and how the needs there to take that comprehensive approach to bring awareness, bring education, but also funding. And I know that we funded the initiative in the county budget last year. Certainly we'll look to fund it, funding again this year as well. So thank you for doing the work, to keep us healthy, and to keep our kids healthy. We're going to need solutions and best practices from all of you. So really appreciate what you do day to day, and I really appreciate that you're here with your conference. So enjoy the conference, and we'll see you soon. Thank you.